Hello, everyone. Today we're going to be talking about infectious diseases in the American Indian and Alaskan Native populations. We will discuss their prevalence, management, contributing factors, and prevention strategies. Today's objectives are to identify the infectious diseases affecting American Indian and Alaskan Native populations, including respiratory infections, hepatitis, sexually transmitted diseases, and various other bacterial infections. To explain social determinants of health that contribute to the higher incidence and severity of infectious diseases in these populations, including barriers to healthcare access, poor living conditions, and historical trauma. To discuss the effectiveness of current public health interventions and policies aimed at reducing the burden of infectious diseases in American Indian and Alaska Native communities. And finally, describe culturally sensitive prevention and treatment strategies that incorporate traditional healing practices and community engagement to address infectious diseases in these populations. Infectious diseases that will be discussed include respiratory infections, tuberculosis, viral hepatitis, zoonotic diseases, Helicobacter pylori infections, group A streptococcus infections, and sexually transmitted diseases. Types of respiratory tract infections that commonly occur include pneumonia, influenza, and respiratory syncytial virus, or RSV. Pneumonia and influenza are caused by various bacteria and viruses, leading to symptoms like fever, cough, and difficulty breathing. AIAN populations experience higher hospitalization rates for these infections. They are spread through respiratory droplets when an infected person coughs, sneezes, or talks. RSV is a common virus that causes bronchiolitis and pneumonia, especially in young children. AIAN children have some of the highest RSV-associated hospitalization rates in the world. It is transmitted through direct contact with respiratory secretions or contaminated surfaces. AIAN populations have higher adjusted prevalence rates of chronic respiratory diseases such as asthma and chronic obstructive pulmonary disease, also known as COPD, compared to non-Hispanic white populations. These chronic conditions may contribute to a higher incidence of respiratory infections in the AIAN population. Treatment for respiratory tract infections are as follows. Bacterial pneumonia can be treated with antibiotics, and the antibiotic of choice depends on the type of bacteria. For viral pneumonia, antiviral drugs may be prescribed. Cough suppressants can help manage coughing, though it's important not to suppress the cough completely as it helps clear the lungs. Medications like acetaminophen or ibuprofen can help reduce fever and relieve pain. Severe cases may require hospitalization for intravenous antibiotics, fluids, and oxygen therapy. Influenza may be treated with antiviral drugs, which can reduce the severity and duration of flu symptoms if taken within the first 48 hours of symptom onset. Symptom management includes rest, hydration, and over-the-counter fever and pain-reducing medications. Severe cases, especially in high-risk individuals, may require hospitalization for supportive care. RSV can typically be managed at home with rest, fluids, and over-the-counter medications to reduce fever. Severe cases, particularly in infants, older adults, or those with underlying health conditions, may require hospitalization for intravenous fluids, oxygen therapy, and sometimes mechanical ventilation. A vaccine is now offered to these high-risk age groups. Tuberculosis, or TB, is a bacterial infection caused by Mycobacterium tuberculosis, primarily affecting the lungs, but can spread to other organs. Symptoms include a persistent cough, weight loss, and night sweats. It is an airborne disease spread when an infected person coughs, sneezes, or speaks, releasing bacteria into the air. AIAN populations have significantly higher rates of TB compared to other racial or ethnic groups in the U.S. For instance, the annual TB rates among American Indian or Alaska Native individuals are on average 10 times higher than among white individuals. Tuberculosis is treated with long-term antibiotics, typically involving multiple drugs over several months. Compliance with this multi-drug therapy is challenging, but vital to cure the infection and avoid development of resistance. Viral hepatitis is mostly caused by the hepatitis A, B, and C viruses, which cause inflammation of the liver. Symptoms can range from mild illness, including fatigue, nausea, vomiting, loss of appetite, and fever, to severe liver disease, manifesting as jaundice or yellowing of the skin and the eyes. Hepatitis A is typically spread through ingestion of contaminated food or water. Hepatitis B and C are spread through contact with infected blood or body fluids, often from high-risk behaviors such as sharing needles or unprotected sex. Hepatitis B can also be transmitted from mother to child during childbirth. AIAN individuals are 3.4 times more likely to die from hepatitis C compared to non-Hispanic white individuals. AIAN populations also show higher rates of hepatitis A and chronic hepatitis B compared to non-Hispanic white populations. Hepatitis A usually resolves on its own with supportive care such as rest, hydration, and a healthy diet. Treatment for hepatitis B is supportive care or antiviral medications to reduce liver damage. Treatment for hepatitis C is direct-acting antivirals that can cure the infection. Vaccines are also available for primary prevention. Native American communities have higher hospitalization rates for zoonotic diseases such as hantavirus, pulmonary syndrome, plague, and Rocky Mountain spotted fever. These rates can be 20 to 40 times greater than those in the general U.S. population. Factors contributing to this include living in rural areas and engaging in agricultural work, which increases contact with disease-carrying animals and insects. Hantavirus pulmonary syndrome is caused by hantaviruses. This severe respiratory disease is transmitted through contact with rodent droppings. Symptoms include fever, muscle aches, and severe respiratory distress. Plague is caused Yersinia pestis and is transmitted through flea bites or contact with infected animals. Symptoms include fever, chills, and swollen lymph nodes. Rocky Mountain spotted fever is a bacterial infection transmitted by tick bites causing fever, rash, and potentially severe complications. Treatment for these particular zoonotic diseases are as follows. People infected with hantavirus pulmonary syndrome are treated with supportive care. Both plague and Rocky Mountain spotted fever can be treated with antibiotics. Helicobacter pylori, or H. pylori infection, is a bacterium that infects the stomach lining, leading to ulcers and an increased risk of stomach cancer. Native American populations, particularly those in Alaska and northern Arizona, show higher prevalence rates of H. pylori infection. The prevalence varies among different Native American populations. For example, among Navajo adults in Arizona, it is around 62%, while it is 75% among Alaska Native populations. This higher prevalence is associated with increased risks of stomach cancer and other gastrointestinal diseases. Helicobacter pylori can be treated with a combination of antibiotics and proton pump inhibitors, which reduce acid in the stomach. Streptococcal pharyngitis, also known as strep throat, is caused by Streptococcus pyogenes, leading to sore throat, fever, and swollen lymph nodes. This infection is primarily spread through respiratory droplets when an infected person coughs or sneezes. It can also be transmitted by sharing food or drinks, or by touching surfaces contaminated with the bacteria and then touching the mouth or nose. Left untreated, it can lead to several serious complications, including heart valve and kidney damage. Invasive streptococcal disease can cause severe infections like necrotizing fasciitis and streptococcal toxic shock syndrome. These serious infections can occur when Streptococcus pyogenes enters the body through breaks in the skin, such as cuts, wounds, or surgical incisions. It can also spread through respiratory droplets, similar to strep throat. Treatment for Group A Streptococcus infections are antibiotics such as penicillin or amoxicillin. The last category we'll cover is sexually transmitted diseases, or STDs. You may also have heard them referred to as sexually transmitted infections, or STIs. Prevalent STDs are chlamydia, gonorrhea, syphilis, and HIV/AIDS. The rates of chlamydia and gonorrhea among AIAN populations are approximately 3.7 and 4.6 times higher, respectively, than those among white populations. AIAN individuals also have higher rates of primary and secondary syphilis, with rates being 2.6 times higher than those among white individuals. Chlamydia and gonorrhea are spread through sexual contact, including vaginal, anal, and oral sex. They can also be transmitted from mother to baby during childbirth. Syphilis is transmitted through direct contact with a syphilis sore during vaginal, anal, or oral sex. It can also be passed from an infected mother to her baby during pregnancy or childbirth. HIV is spread through contact with certain body fluids from a person with HIV, such as blood, semen, vaginal fluids, rectal fluids, and breast milk. Common transmission methods include unprotected sex, sharing needles, and from mother to child during childbirth or breastfeeding. Chlamydia is typically treated with antibiotics such as azithromycin or doxycycline. Gonorrhea is treated with antibiotics, often ceftriaxone combined with azithromycin. Penicillin is the most effective treatment for syphilis. Antiretroviral therapy, or ART, is used to manage HIV/AIDS. Prevention of these infections is as important as treatment, including increasing awareness about STDs and their transmission through community education programs, encouraging regular STD testing to detect infections early and prevent their spread, promoting the use of condoms and other safe sex practice, vaccination against hepatitis B and HPV to prevent related infections. AIAN populations often face barriers to healthcare access, including geographic isolation, lack of transportation, and limited availability of healthcare facilities. Additionally, there are disparities in health insurance coverage, which further restrict access to necessary medical services. Many AIAN communities experience poor living conditions, such as homelessness or overcrowded housing, lacking adequate sanitation and access to clean water. These factors contribute to the spread of infectious diseases and exacerbate health issues. The legacy of colonization, forced relocation, and cultural suppression has led to intergenerational trauma among AIAN populations. This historical trauma impacts mental health and can lead to higher rates of substance abuse and other health problems, which in turn affect the incidence and severity of infectious disease. Let's look at some ways to help prevent the diseases we discussed earlier. Promote vaccines for illnesses like flu and hepatitis B to prevent outbreaks. Improve healthcare services in rural and underserved areas so people can get timely treatment. Create health programs specifically for American Indian and Alaska Native AIAN communities. These should improve access, track diseases better, and offer care that respects cultural values. The Indian Health Service has made progress in reducing health gaps, but challenges like limited funding and staff shortages still exist. Push for policies that boost healthcare funding, improve infrastructure, and support local health initiatives in AIAN communities. Develop health education that respects traditions and raises awareness about how to prevent infections. Use culturally sensitive outreach to improve understanding and encourage healthy habits. Encourage routine health checks to catch and treat diseases early. Involve AIAN communities in designing and running health programs. This ensures the programs are relevant and accepted. Include traditional practices like herbal medicine and spiritual ceremonies to support a more holistic approach to health. While progress has been made, ongoing efforts are needed. Continued investment, better access, and strong partnerships are key to long-term success. Here are our references. Thank you for listening to this presentation.